A voice clinic is a specialist outpatient clinic in the ENT department for patients experiencing difficulties with their voice. You will access professionals with experience and expertise in voice difficulties and to equipment that supports making an accurate diagnosis and treatment plan. Why am I being referred? You might be experiencing dysphonia, which means a change to your voice such as weakness, breathiness, hoarseness or unexpected breaks in the voice or pitch changes, or aphonia, which means a complete loss of voice. This might mean that you're unable to produce more than a whisper. It is essential to see your GP if you're experiencing hoarseness that persists longer than 3 weeks, and they can make a referral to ENT. Depending on the nature of your voice difficulties, you'll be either seen in our joint voice clinic, which is run by Mr. Webb, ENT consultant, and one of our speech and language therapists who specialise in voice, either Sally Dennis or Joe Clayton, or in a speech and language therapy-led voice clinic. We also have access to a singing specialist if you have specific issues with performance and singing. You'll be asked to complete a short questionnaire about your voice and how frequently you are experiencing issues relating to voice use. This usually takes place in a waiting area before you are called in for your appointment. You will be asked information about your difficulties, when they started, and questions about your medical history and lifestyle to help the team evaluate your difficulties. It is usual for us to carry out a visual assessment of your voice box or larynx to support diagnosis and understand what is causing the dysphonia. Most patients with hoarseness do not have damage or disease to their larynx, but instead have issues with the way they are using their voice or straining it. A small flexible tube or scope is inserted into one of your nostrils through the nasal space to the top of the back of the throat, while you are seated comfortably. The position of the scope will not induce a gag reflex. Mild discomfort in the nose is reduced when a topical local anaesthetic spray is used. You will be asked to carry out some different vocal tasks and repeating short phrases and sounds given to you. If you are a singer or performer experiencing issues with your voice, you may also be asked to sing a section of a familiar song so we can visualise your voice box during singing. The image is displayed on the screen in the room, and it is recorded and can be played back immediately and at a later date. Advice and information about treatment will be shared, and you may be referred on for voice therapy, for surgical input for a small minority of cases, or to another specialist. There are some procedures we are able to carry out in clinic, such as vocal cord augmentation and Botox treatment for spasmodic dysphonia. To reduce transmission risk of COVID-19 during the procedure, additional PPE is currently being worn by the professionals in the room. This typically comprises an FF3P mask or respirator mask, a clear visor, gown and gloves. Voice therapy involves education on healthy and efficient voice use, which may involve exercises enhancing posture and breath support for voice, and tension reduction, offering voice care advice, and exploring lifestyle factors and stresses which may have contributed to the hoarseness. The therapist will be able to monitor progress with managing these factors to improve or restore a good voice quality. Surgery is only required in a minority of patients. Occasionally, surgical decisions are delayed following voice therapy trial or to support adaptation to voice production patterns to support optimal recovery following surgery. Rest your voice where possible, reducing overall voice use. Avoid pushing your voice out and aim to use it gently. Drink plenty of fluids, particularly water, and reduce or avoid alcohol, tea and coffee. Start medical management of acid reflux if reflux is thought to be a factor in your case. Stopping smoking improves vocal health and reduces risk of related disease.